Hi, I'm Laura, a patient navigator, and I'm here today on behalf of your oncologist. During your consultation, your doctor had discussed about giving a chemotherapy called ddACP regimen. In this video, I want to explain about this chemotherapy treatment. What is ddACP? ddACP is a chemotherapy treatment with a combination of 3 drugs that are used to treat breast cancer. DD equals dose dense. A is for adriamycin. C is for cyclophosphamide. P is for paclitaxel. Adriamycin is an anthracycline class of chemotherapy treatment, and it is also called doxorubicin. Cyclophosphamide is another type of chemotherapy medicine called an alkylating agent and sometimes called as Cytoxan. This combination is followed by another type of chemotherapy medicine called a taxane. The taxane used the most is called paclitaxel. Another name for it is Taxol. How ddACP works? Adriamycin damages DNA of cancer cells and prevents their growth, while cyclophosphamide stops certain protein synthesis in cancer cells and prevents their reproduction. Paclitaxel or docetaxel damages the structure or the skeleton that supports cancer cells and prevents division and growth. Who gets ddACP? ddACP is a standard regimen for breast cancers that require treatment with chemotherapy. Women with cancer of a higher grade and younger women often get this combination. It can also be used in people who have had a reoccurrence depending on the medicines you received for early-stage disease. Sometimes the AC portion is given before surgery and paclitaxel is given after, based on the cancer that remains in the breast after surgery. How ddACP is given? ddACP can be given after surgery as adjuvant therapy or before surgery as neoadjuvant therapy. Sometimes the AC portion is given before surgery and the taxane after, based on whether the cancer remains in the breast after surgery. Both AC and P are given by vein, mostly via an infusion port. ddACP is usually given in a total of 8 cycles, once every 2 weeks. The first 4 cycles include AC, and the next 4 is paclitaxel. What are the side effects from ddACP treatment? It is important to remember different medicines have different side effects for different people. You may not have every side effect related to each medicine of the combination therapy. Side effects of ACT may include less common but serious side effects such as heart problems. Your doctor will obtain a baseline echocardiogram to monitor your cardiac function before starting the treatment and periodically as necessary. Arrhythmias. You may experience persistent palpitations or heart racing. Please call your doctor if you have a fever over 100 degrees Fahrenheit, fatigue, shortness of breath, heart racing or palpitation, discomfort lying on your back, swelling of the ankles, cough, difficulty in breathing. Most common side effects of ddACP may include low red cell counts or anemia. With anemia, you may experience a lot of fatigue, palpitations, increased heartbeat, and shortness of breath. Low white blood cell counts. Your doctor will administer a G-CSF medication 24 hours after treatment to reduce chances of infections. Nausea and vomiting. ddACP regimen can cause 2 types of nausea or vomiting. Immediate nausea, vomiting occurs within 1 to 2 hours of chemotherapy administration and can last for up to 24 hours. And delayed nausea or vomiting presents more than 24 hours after chemotherapy administration and can last up to 5 days. For vomiting, your doctor may prescribe other oral nausea medications like ondansetron, prochlorperazine, or promethazine. Dehydration from diarrhea or vomiting. Unaddressed nausea and vomiting or diarrhea may cause dehydration, and you may experience symptoms of low fluid volume. Increase your fluid intake and call your doctor so you can be evaluated right away. Neuropathy. Commonly caused by paclitaxel, and you may experience tingling or numbness from neuropathy. When it is severe, you may have trouble with your walking, buttoning your shirt, or handling the doorknob. Loss of appetite, hair loss, mouth sores, bladder irritation, bone pain, diarrhea, increased risk of sunburn, or menopausal symptoms. Your doctor will check your blood before you start treatment. If your blood count is low, then your treatment may be delayed. Please call your doctor if you feel you are not well and if side effects do not improve after medications. Please tell your doctor about any medicines you are taking, including vitamins, herbal supplements, and over-the-counter medicines, to make sure they don't interfere with your treatment. For managing a specific side effect, please watch our symptom-specific video. Call 911 immediately if you experience a medical emergency. If you have additional questions, contact your doctor's office, or you can always ask an oncologist in the OncoPower app. Thank you for watching. Feel free to replay this video as often as you would like to. Thank you, and good luck.